Hello, we're back and we're continuing on with pregnancy, except we're dealing with what happens after the delivery with the newborns. These codes only go on the newborn record. They have some nuances, but a lot of students find this easier than the OB chapter. Let's take a look and go from there. And again, all these codes for the perinatal, in other words, the newborn period, begin with the letter P, as in perinatal or pediatrics. And these codes include things such as a newborn that's affected by maternal factors and complications of pregnancy, falling in code categories P00 through P04. Note that some of these will have corresponding maternal factors that will be coded from the chapter we just got done talking about. In other words, they'll start with O. These will be the codes that you would have found by using pregnancy complicated by. Going on, we have P05 through P08, disorders of a newborn related to the length of gestation and fetal growth. P09, abnormal findings on neonatal screening. P10 through P15, birth trauma. P19 through 29, respiratory and cardiovascular orders. And 35 through 39, infections specific to perinatal period. Then we have hemorrhagic and hematological disorders falling in code categories P50 through P61. P70 through 74, transitory endocrine and metabolic disorders. 76 through 78, digestive disorders of the newborn. 80 through 83, integument and temperature regulation disorders. P84, other problems. And then P90 through P96, other disorders originating in the perinatal period. Codes in this chapter describe conditions that begin before birth and develop during the first 28 days of life. In other words, the newborn or perinatal period. These are not congenital conditions. These are conditions that are perinatal or newborn, as opposed to something that somebody was born with. These are problems that began before birth or developed in the first 28 days. So we're talking about two different things. These conditions that develop in the newborn period may continue to exist and actually continue on through the rest of the patient's life. These codes are only for use on the newborn and the infant record. We don't use them on the maternal record. If the condition originated in the perinatal period and continued through the life of the child, the perinatal code still is used regardless of the age of the patient, so they don't age out of these codes. There are a lot of instructional notes in this, and one of the big ones is right here under P07. When both the birth weight and the gestational age of the newborn are available, both should be coded with the birth weight sequence before the gestational age. You will see this time and time again. So when both are documented, and often they are, you want to put the birth weight first. P08.21 notes, newborn with a gestational period over 40 weeks to 42 completed weeks. So we have specific guidelines on that, but the big one you want to remember is this one. So birth weight comes before gestational age. And codes from these categories are for use when the listed maternal conditions are specified as the cause of confirmed morbidity or potential morbidity that have their origin in the perinatal period. Here's what we're talking about with this. If you have a mother whose pregnancy is, quote, complicated by drug use, alcohol use, HIV status, or whatnot, you will have corresponding perinatal codes. So you have those codes that affect the pregnancy that start with O, and then on the newborn's chart, you'll have a corresponding code that falls into P0 through P04. And again, big points to remember here are as follows. They're only used on the never used on the maternal record, only on the newborn chart. You can use them throughout the life of the patient as long as they're present when the patient has an encounter with the healthcare services or is admitted. The principal diagnosis for the birth record frequently will have babies born in a hospital that doesn't have a neonatal intensive care unit, and they'll be transferred over. You only have the newborn record once at the hospital where the baby is born. We don't use that newborn code of Z38 at the hospital the child's transferred to. And this happened frequently in San Francisco. We have a baby born at, say, St. Luke's, and for whatever complication the baby had, they would be sent over to UC San Francisco or Zuckerman San Francisco General Hospital, where they did have an NICU, and they would not use that Z38 code at UC San Francisco. The Z38 code is only used when the baby's born at the original hospital where the mother gave birth. We can use codes from other chapters with these if the conditions exist. Now, when a baby is transferred to a hospital with an NICU, that condition will be the principal diagnosis. In other words, that's the condition for admission after study. And if you got that, you've got a lot of what you need to know for this specific chapter. They're chapter-specific guidelines. And again, a lot of these fall right in line with the general guidelines that we know and love at this point. We code all clinically significant conditions if it requires any of the following, as it says in the second set of bullet points. Any type of clinical evaluation, therapeutic treatment, diagnostic procedures, extended hospital stay, increased nursing care or monitoring, or implications for future healthcare needs. So if you think about those general guidelines that we introduced you to in the first 2 weeks of the course, they most definitely apply here in Chapter 16. There are more guidelines, observation and evaluation guidelines, right? So in other words, if we're observing and evaluating, if you think about it, this makes total sense. When they're being evaluated and observed for a suspected condition, that's a Z05 code. Once they've worked up the infant and they determine what the diagnosis is, we don't use the Z05 code. Why? Because we have a diagnosis, and that's the reason that the patient was admitted after study. Goes back to that definition of what a principal diagnosis is. And more guidelines about coding additional perinatal diagnoses, all these other different types of things. Big one here, as we've talked about, low birth weight and immaturity status, right? So when both the weight and gestational age are documented, there's specific guidelines on that, as we talked about. Bacterial sepsis. If a baby is born with congenital sepsis, right, the P36 code does not include the organism. Therefore, we have to assign an additional code for the organism. Again, another code, stillbirth. And again, we don't see this all the time, the code P95, stillbirth. We have some hospitals in other states that maintain separate records for stillborns. No other code is used with P95. P95 does not go on the mother's record. If we think about it, all the codes that begin with the letter O, maternal, all the codes that are for the neonate, the baby, the perinatal, start with a P, they go on the newborn chart. There are new guidelines, which is one reason that we always want to get the new books, is specific guidelines that address COVID-19 infection in newborns using the US 7.1 with newborn codes. These can include Z38, P35.8, and other codes. And again, we talked about maternal factors, disorders related to the length of gestation, in other words, prematurity, birth trauma, infections. All these can affect the newborn. Codes P00 through 04 are intended to describe newborns affected by maternal factors and complications. This could be, for example, P00.3, newborn affected by maternal circulatory and respiratory diseases. P00.4, maternal nutritional. P00.5, newborn affected by maternal injury, and so on. And in the previous chapter, we talked about pregnancy affected by. Well, now we're going to have something on newborns. Main term, newborn affected by, usually will take you to the correct code. The P05 through P08 are used for infants that are affected by prematurity or fetal growth. These are similar but not the same. Prematurity is a short gestational age. Fetal growth is that they went full term, but for whatever reason, they're lighter and smaller than expected for their gestational age. And again, we have specific carve outs, as you can see here, right? So, really important to look at the record and make sure that we get the right code assigned based on the weight. And physicians have to document a newborn's prematurity and estimated gestational age. There's an exclude one note that makes perfect sense under P07 that excludes codes from P05. Let's take a look. And again, if we have short gestational age or prematurity, we can have long gestational age and high birth weight. So we have P08.0 for exceptionally large newborn babies, in other words, a baby that's born greater than 4,500 grams. P08.1 is for a baby weighing in at 4,499, excuse me. And then we have the subcategory for the late newborn, not heavy. Again, really important, please pay special attention to these main terms: premature newborn, preterm newborn, immaturity, small for dates, light for dates, low birth weight, heavy for dates, and large baby. And again, we can have conditions associated with meconium, which is a sign of fetal distress, P0 3.82, P2 4.00, etc. Right? And again, the baby can pass meconium in utero. The amniotic fluid can have the staining that they commented on. And again, the big concern is whether the baby will aspirate on the meconium into the lung, causing meconium aspiration syndrome. Right, so a lot of distinct codes for meconium passage, meconium aspiration with or without respiratory symptoms, meconium peritonitis, and all these other things. And again, we have respiratory and cardiovascular disorders specific to the perinatal period, falling into P19 through 29, the respiratory distress syndrome, flame lungs with pulmonary edema, all these different types of things falling into these code categories. And then we can have infections that can be acquired either in utero or after birth, what have you. And again, this one, the Z38. These are the newborn codes. These are live-born infants according to the place of birth and type of delivery. If a baby is born, the principal diagnosis, and this kind of goes back to our definition of what a principal diagnosis is it's the reason for admission after study. If a mother comes and she goes to the delivery room and then she gives birth to a baby, the reason for admission for the baby to the hospital, if you think about it, is in fact being born. And this is a Z38 code. Key point here, Z38 code is only used once at the time of the birth. Even if they're transferred within 30 minutes to another hospital within an ICU, the principal diagnosis would be the reason that the baby, the infant, if you will, is transferred to the receiving hospitals and ICU. It's not being a newborn. And again, the main term for that one is newborn with the subterm for the place and the number of infants. And that's all I have for you. Thank you for watching. Please stop by office hours if you have any questions about this material. Bye now.